Hello. Uh, Thank you, and I'd like to thank PDA and the FDA for inviting me to be here, and the planning committee, which I think has done just a great job with this conference. Actually, I should probably thank you on behalf of my students. They seemed to be quite relieved when they found out they'd get to watch a video today and someone else would have to listen to me speak. So when I was invited to speak at this conference, I started sort of wondering what I could add to the conversation here. And I started going through the conference materials, and two words sort of struck me. One, safe, and the other, available. This idea of safety and availability. And so I said to myself, I can, as a patient, address these. So I am here because I've encountered issues of safety and availability. I am here in part because of what I think most of us have in common, and that is that we have gone to our healthcare provider, found out that we needed treatment that required some medication. We've gone to the pharmacy and had that prescription filled, and we've taken that medicine, or someone in our family has. I'm here for things, hopefully, that we don't have in common. To start, last year I took over 10,000 pills. So I've spent a lot of time with pharmacists and pharmacies, and a lot of time thinking about the medication I take. But let me back up. I grew up in the gold rush country of California in a very, very small town, about 1,200 people. And I grew up with a mother who was ill a lot of the time, and I had my first asthma attack when I was 1, so for as long as I can remember, I've had an inhaler and taken liquids and pills and allergy shots for a number of years. And so I sort of grew up with this idea of medicine making me better. And I grew up in a town where we had one pharmacy, one pharmacist, Mr. Barry, and he was really the frontline defense in our healthcare system, right? So if I got sick, my parents would take me to Mr. Barry, explain what was going on, and he would say, well, go to aisle 2 and pick up such and such product. Or he would say, it sounds like you need to take him to the doc, and I would go to the town doctor and generally go back and get a prescription filled from Mr. Barry. And in middle school at some point, we got asked the question, what do you want to do when you grow up? And at that point, I decided I wanted to be a pharmacist. This was really interesting to me, and certainly something I had a lot of experience with, even as a student in middle school. And luckily for me, Mr. Barry agreed that I could spend a couple of weekends with him behind the counter, seeing what a pharmacist does. And we talked about his training and why he liked being a pharmacist and his role in healthcare. He also gave me cinnamon oil that I could soak toothpicks in, and made me very popular at school. And I watched him fill prescriptions, and once in a while even compound a product for a patient. And I found this really interesting, and I asked lots of questions. But never once at that point did it occur to me to ask how the medicine made it to the shelves in his pharmacy. I never thought about that. I watched him take the pills off his shelf and give it to patients, but never really thought about how they got there. And now, of course, I understand the complexity of that and the hard work and the number of people it takes to get that medicine to the pharmacy shelves. But at the time, I hadn't thought about it. I graduated from high school and moved into the dorms at the University of San Francisco, where I teach now. And it was very exciting. I was in San Francisco and exploring a very fascinating city. I was taking classes that I found really interesting. In the dorms, I was meeting people from all around the world. I was dating. Life was good. Life was great. I was 18, and it was 1981. Little did we know what was happening, though, until about a year later, we started hearing reports about a new disease. And it was affecting relatively healthy young men. And they were dying. And when HIV was identified in 1984, it was too late for many of us. We had already been infected. And my friends started getting sick and dying. And in 1988, it was my turn to get very sick and diagnosed with AIDS. The 80s were not a good time for anyone who had AIDS. And there are a lot of people that didn't make it to the 90s that I knew. I never thought I would be 30, and this last summer I turned 50. So let me tell you a little bit about that journey. When I was diagnosed, there was only one drug available, and that was AZT. And I think as soon as you got a diagnosis, you felt like that was your hope, that you had to get your hands on some AZT, that it was the one hope we really had at possibly getting better. And I had friends who qualified for clinical studies and were able to get AZT that way. But for a lot of us, we were young, uninsured, and it was expensive. It became sort of a regular common practice to go to funerals or memorial services, which were happening. It felt like at least monthly, you found yourself at one of these memorial services. It was pretty common to go ask somebody, hey, did they happen to leave any AZT? And then you'd get that AZT, and if you had a month's supply, you would share it with somebody who didn't. I don't think there was a single dose of AZT ever wasted in San Francisco, because we all knew everyone else needed it if we had extra. I had a friend, Mike, who was dying of PML and had stopped taking AZT, but a few days before he died, he ordered a full month's supply. And the day he died, his partner called and said, Rick, he really wanted you to have it. He left you 4 bottles of AZT. And at the time, that was an incredibly significant gift. Maybe I shouldn't have said that with a bunch of regulators in the room. But they were desperate times. They truly were desperate times. But soon, ADAP was developed, the AIDS Drug Assistance Program. Manufacturers came up with assistance programs for patients to get medications. The FDA started fast-tracking potentially helpful and efficacious HIV meds, and there were expanded access programs. And so we started getting new medications and new options, and I think our hope increased. When preparing to talk to you today, I tried to go through the list of clinical studies I've been a part of, and I just have completely lost track. There have been so many of them. But each time I know I was in that study because, for me, I believed there was hope. At the end of next month, I'll have spent 25 years living with AIDS. 2/3 of that time, I've had a detectable viral load. Obviously, the goal is to have an undetectable viral load. And we tried lots of cocktails, combinations, and just could never get my viral load below a measuring point, an undetectable viral load. And because of that, I'd been on all the HIV medications available, and I'd become resistant. The virus had become resistant to all the medications available. And my doctor and I were getting a little desperate, and she actually called some other docs around the country, and we came up with 2 medicines, one that was in clinical studies and one through expanded access. And I was able to put together a new cocktail with the newest of medicines, and for the first time, my viral load became undetectable. And again, there was hope. I know that I would not be here if it weren't for innovative and available new medications. I have no doubt about that. As a patient, what do I know about safety? Well, first, when you take 10,000 pills a year, you just hope that they're safe. But in 2000, I was diagnosed with AIDS wasting syndrome, and it doesn't look like that right now, but I was wasting away in 2000. And I had failed on a number of treatments for AIDS wasting syndrome, and the last resort was a drug called Serostim, and I was very fortunate at that point that my insurance company approved a 12-month supply of Serostim. So I went to the pharmacy, and got my first month supply. It came in a box with sets of vials, and one vial was diluent, some sterile water, and one was a vial that had a white pellet at the bottom, and you'd reconstitute that, and I injected it every day. And about 6 months in, I'd had really tremendous results, and we were feeling very confident that I was better and getting better. But I noticed some stinging when I was injecting myself, not just the usual I'm giving myself a shot stinging, but stinging that lasted until the next day. And that was different. I hadn't had that experience. And I was looking for infections. You know, when you have a compromised immune system, you're always sort of hyper aware. But I didn't see anything, and I thought I should ask my pharmacist about this. But it was the holidays the next time I went in, and it was busy, so I just grabbed my next supply, month supply, and went home and started taking that a couple weeks later. And the stinging went away, which was really a nice relief. But the amount of diluent in the bottles was not consistent anymore. I'd draw it out. Sometimes there'd be 1 cc, sometimes there'd be a little less, sometimes a little bit more. And I thought, well, they're having some manufacturing issues here, right? So I want to talk to my pharmacist about it. And so the next time I went to my pharmacist, I go to a major national chain of pharmacies, and I went to the pharmacist and explained about the stinging and about the diluent, and he just looked at me and said, oh, well, you should go home and check. You may have gotten some of the fake stuff. And at that point, I had no idea what that could possibly mean. I mean, I went to my pharmacy, I got my medicine, I took it. And I said, what fake stuff? What do you mean by that? And he said, well, there was a recall. We sent back what we had on the shelves, but maybe you got some. You should go home and check. So I got on the bus and got home and immediately pulled out boxes from my wastebasket and boxes that I still had, and I assumed what I had just picked up was real, and I compared them, and I had 3 distinct groups of packaging. And I went online, and I found an article in the Boston Globe that said Serostim had been counterfeited and found in 7 different states, and that the FDA and the manufacturer had recalled the product, that it was a false lot number. It had nothing to do with them, but they were recalling it because it was a false lot number that had been made up, and it was a complete counterfeit. And so I looked at the details they had on the FDA website, and I compared it, and it certainly matched one stack of my medicine. Then I had this other stack. So I called the manufacturer to let them know, and they said, no, there's only one. You can give us that, and there's only one counterfeit, and we're not sure what else you're talking about. So I went to my doctor, and I said, I'm really pretty upset. It seems like the FDA knew, and the manufacturer knew, and the pharmacy knew, and I didn't understand why nobody told me. And I wondered how many people out there had failed on their Serostim, and the doctor thought, oh, this person has just failed on another treatment. And, okay. So I wondered how many people maybe had failed and had no idea that it wasn't that the drug was ineffective, but rather that they had received a counterfeit. I know if I had a car part that was bad, someone was required to contact me, tell me that there's a recall, and I would take my car in, and if I didn't, they have to track me and notify me again. But it doesn't seem like that there's any requirement like that with pharmaceuticals. And I went to my doctor, and I had explained that to her, and she said, Rick, most importantly now, what we need to know is what you injected yourself with. If you injected yourself with something else, we obviously know you didn't get the medicine you needed. But what did you inject? We need to know, and we need to know if there's something we should be doing about that. And the enemy at that point had been HIV, but now there was this other variable. And I called the manufacturer, and of course, they said, we're cooperating with the FDA investigation, we can't talk about it. And then I called the FDA, and the FDA said it's an ongoing investigation, we can't talk about it. And that all made sense, but I became really distraught by not knowing what I had injected. And it started to consume my thoughts. My fear was that someone had put hepatitis C in those vials, and I had injected myself with hep C and made my doctor check, of course. And it was a nightmare, 6 months of a nightmare of having a hard time focusing and sleeping. It took 3 months to find out what was in the first batch, and another 3 months to find out what turned out to be a second batch. So I had received 2 different sets of counterfeits, 2 months in a row, perpetrated by 2 different sets of bad people. I don't know what the odds of that are, but I did it. And the first batch turned out to be human chorionic gonadotropin, and I had been injecting myself with that, and that is the hormone women make when they are pregnant. It's certainly not meant to be injected sub-Q. It's not meant to be injected every day, and certainly not into a male. I say, though, to people that it helps explain why I suddenly burst into tears during Hallmark movies. And I gained an appreciation I did not have before. And I suppose if I had thought about it and taken a pregnancy test, I would have come out positive. The next batch turned out to be a very diluted form of growth hormone, not serostim, and I was told based on the contaminants found that it was produced somewhere overseas. I needed to know how this could happen and really who would do something like this. So I did some research and followed and made lots of phone calls and talked to reporters who were following these cases and help from the FDA to sort of fill in the blanks. And I was asked to testify against 2 of these bad people in Las Vegas. And it's covered in a book by Catherine Eban called Dangerous Doses, if any of you have read that book. And one chapter is about this hearing the Nevada Board of Pharmacy held against these 2 bad guys in Nevada. And they were found guilty, or their company was found guilty. And it turns out their sole supplier was a secondary distributor licensed in the state of Florida under the name Reckitt. And I think they are a good example of the kind of people who are willing to do this, what I would consider heinous crime, depriving someone of their medication and then potentially giving something very dangerous. The licensed distributorship, I said, was under the name Reckitt, R-E-K-C-U-S. And it tells you something about these people when you recognize that is sucker spelled backwards. And another one had blue pill as his license plate, sort of touting the fact that that little blue pill was the #1 counterfeited drug at the time. These are really bold people and really bad people. And they don't care about me. They certainly don't care about others. They don't care about anyone who needs medication. They'll take advantage of every opportunity, and especially now, as we know, the use of the internet. If you had asked me when this happened 10 years ago, if I would be talking about it more than a decade later, I would have naively said no. But here I am, telling the story 10 years later. I am encouraged by the changes that have happened since 2001. It was nice yesterday morning to see how those regulations had changed over time. I really appreciated those presentations, and I could see where I fit into that and the things that had changed post my experience, and certainly all those changes with patient safety in mind. But it's also clear to me after listening to some of the presentations that this is a global problem, and a problem that's going to continue requiring us to be diligent and work hard, part of industry and of regulators. I have no doubt that my life is dependent on the medications I get every day. But in the end, this speech isn't just about me. It is about all of us, because every one of us at some point will have a family member or ourselves need a prescription to be filled. So in the end, it's about all of us and making sure that when we go to the pharmacy, we have drugs available and that those drugs are safe. And so I'd like to end by thanking all of you for working hard to make that happen. I appreciate it on a daily basis. And it's been nice to be able to meet some of you over the last couple of days. And maybe I'll get to meet some more of you this afternoon. But again, thank you.